Good afternoon, everybody. Thank you for coming today for our wellness program. My name is Barsha. I'm a pharmacist, and I practice in town since last 8 years as a pharmacist / pharmacy manager. Some of you probably know me from getting a flu shot from me. We do flu shots to our city employees since last 2 years, and I was working for Walgreens for last 14 years as a pharmacy manager, and about 6 months ago I opened up my own pharmacy. It's a retail independent pharmacy called Caring Pharmacy in High Spring. Today we will talk about an adult immunization. So we all need vaccines. Some of them are required on a yearly basis, some just once in a lifetime, some maybe 2 or 3 times in a life. These vaccines are very, very important to keep us healthy and not get sick and hospitalized, or maybe in some case a death. So the most important one that we need to do on a yearly basis, that is my favorite, is the flu shot. What is flu? So flu is an influenza virus that somehow here in the United States we see very common during our winter, usually between October and May. Their symptoms are fever or chills, sore throat, muscle aches, fatigue, cough, runny or stuffy nose. And most of us needs 3 to 4 days off work, just resting ourselves, felt miserable. This virus is very contagious. So people think that, oh no, I don't need a flu shot, I'm very healthy right now. Well, you might not need a flu shot, but if you carry that virus, you can give out to your young children at home, or a senior people around you, or other people at work who are not as strong in terms of immunity, and they can get sick from you. Flu can make some people more sicker than others, like young children, people over 65, people who have already some existing health conditions, and pregnant women. This flu can also lead into a pneumonia, and most people have much worse conditions because of the pneumonia that requires hospitalization. And it says each year thousands of people in the United States die from flu, and many more are hospitalized. There are 2 different types of flu vaccines. One of them is a flu shot that comes as injectables, and that is a dead virus. There are a lot of different philosophies, or people have different views about shots. Some people say, no, if I get a shot, I get sick. The only time I get sick is when I get a flu shot, so I'm not doing that, which is not right. Flu shot cannot give you flu. 2 kinds of shots. One is a dead virus, so it is complete dead virus. There is no way it gives you a flu. The second one is a live attenuated virus, which case the vaccine is made up from a virus which are not completely dead, but they are weakened to the point where it cannot give you a flu. Those live attenuated viruses are in the form of a nasal spray. So if you are really worried about a shot, if you have a needle phobia, you can go with that nasal spray, which you can only do if you are less than 49 years of age. There are some restrictions where people cannot take flu shots, but now they have a preservative-free vaccine. They have vaccine for people who are allergic to eggs. So pretty much everybody over the age of 6 months can get a shot. So it says each year they develop a new flu shot. So he's like, why do I need it again if I got it last year? Based on the flu breakout year before, or the last season, in area and in other parts of the world, they develop a new vaccine. The vaccine have to go through several trials and that production process, and during August or September, the new vaccines are available in the market. And it is recommended to get that new shot every year to boost your immunity and develop the antibodies against the virus. Once you get a shot, it takes about 2 weeks for that immunity to build up in your system where you can actually protect yourself against the flu. So if you get a shot and you got a flu after 3 days or so, you didn't really get a flu from the flu shot, but you catch a virus before your flu shot is fully effective and protecting you. So it's just an coincidence of you getting a shot and getting sick for something that you already got in. So it says, who needs a flu vaccine? And the choices are you. Every single person over the age of 6 months. All right, so this is all about flu shots. Anybody have any questions on a flu vaccine? We'll have question and answer session at the end of the presentation also. But if you have anything right now, I can address that.
When's the best time?
Okay, FDA says as soon as the new vaccines becomes effective. Most people, I would say right now, vaccines are becoming available sooner and sooner every year. So August would be probably too early to get a shot. If it's available in August, we'll wait until September. So then it takes about 2 weeks to build up the immunity. So starting October, you are ready, and that's when normally from November the flu season starts. So you are ready to go. Okay, so what is a pneumococcal disease? A pneumococcal disease is caused by infection by a bacteria called Streptococcus pneumoniae. So it is a bacterial infection, not a virus like flu. And this bacteria can spread from person to person through close contact. Pneumococcal disease can lead to severe health problems such as pneumonia, blood infections, or meningitis. Children younger than 2 are at higher risk for serious disease than other older children. People with certain medical conditions, like the people who smoke cigarettes or who have asthma and heart or diabetes, put them at a little bit higher risk than other individuals. There are 2 kinds of vaccines available. One of them is SCV13 and the other one is the polysaccharide 23. So there are about 90 different types of pneumococcal bacteria, and this PCV13 is a group of 13 different strains of pneumococcal bacteria that is mainly the one that's causing the disease in children, and about 50% adult pneumonia are caused by those 13 strains. They recommend that to younger people who are at higher risk. Younger adults, I would say. All children gets that, and then adults between 18 and 64 gets it only if they smoke, they have asthma, or they have other medical conditions, or anybody who wants to get it can get it too. But then when everybody turns at the age of 65, it is recommended to get one, which is the 23 now. But last year, FDA changed the guidelines where they require 2 pneumonia shots now. The first one would be the 13, and then a year later, you take the 23 strands of pneumonia vaccine. Most healthy individuals develop the protection within 2 to 3 weeks of getting the shot. Since about 4,000 adults still die each year because of pneumococcal infections. Pneumococcal infections can be hard to treat because some strains are resistant to antibiotics. And this makes prevention through vaccination even more important because some of those bacteria are so resistant to our existing antibiotics that once you catch the infection, it is very hard to treat them. Okay, now shingles. Shingles is a painful skin rash that has blisters, and it's often on just one side of your body. It can occur where the pictures have that rashes, or even head or shoulders, but normally on one side of the body, of the face or any part. The main symptoms of shingle is the pain. So you see a blister, you don't know whether it's an allergic reaction or something has just bite you, but if it is painful, if it's very, very painful, it is definitely shingles, and that's the main symptoms. Other symptoms are fever, headache, chills, and upset stomachs. Just 1 in 5 have severe pain, and that can continue even after the rash is cleared up. I have seen customers who are complaining about shingle pains for more than a year, and one of them had in their head, on the hair where they can't even wash the hair. It's so painful to touch. One person got it in the eye, and they lose their eyesight. So it is very, very bad, I would say, nasty disease. Shingles is caused by a varicella zoster virus, and this is the same virus that causes chickenpox. So if we got a chickenpox when we are little, we have the virus in our body, and it stays dormant for years, and it can come out as shingles at a later age. And if we didn't catch chickenpox, but we had a chickenpox vaccine, they said sometimes that can cause a shingles too at a later age. You cannot get shingles from someone who have shingles. So shingles are not contagious. Once you have it, you cannot really give it to somebody next to you, but chickenpox is contagious. So even though it's the same virus, if you have chickenpox, you can get chickenpox, but if you have shingles, you cannot give shingles to somebody else. Now, this vaccine was licensed since 2006, and it doesn't really have a 100% prevention rate, but it prevents about 50% of you getting the shingles. And if you do get a shingle after getting a shot, the intensity of the pain or the severity of the disease is much less than what you could have without getting the shot. Right now, the FDA have approved the vaccine for age 50 and older. And that doesn't mean that you can get shingles only after the age of 50, but somehow the age limit is 50 and older, so we have sometimes younger individuals looking for a shot, but we can't give it to them because it's not recommended by FDA. Side effects from vaccines is mainly a redness and inflammation at the injection site. So you do that, and some pain, not a lot of pain, but some people do feel pain where we recommend them to take either Tylenol or ibuprofen. Some people, about 10% population, develops flu-like symptoms, and that lasts for maybe a couple days, and then again just take the symptomatic treatment against those symptoms. Unlike flu shot is very light. Most people do not feel anything afterwards. This one, I would say about 60% people do have some inflammation and pain, but it's much better than having a shingle pain, and it only lasts for a couple days. You have Blue Cross, and Blue Cross doesn't cover 100%, but I think you have $65 copay if I'm not wrong. We can always check and see how much, but it's $65 or $75 copay. So we can definitely check that. But if you don't have insurance, then it's about $235 or $240. So it's expensive. Yes, sir. No, the virus is in your system. So they can. Well, the possibility of catching a actual shingles from a chickenpox vaccine is much less, because again it's a dead virus that you're exposing to. But then you can get exposed to chickenpox or that virus because it's contagious from anybody and not actually develop the chickenpox, but get exposed to that virus, which can develop shingles when you get older. So I would say, regardless of you having chickenpox when you were little, when you reach to that age, it's better to have a shingles shot. Medicare or city insurance, nobody covers it 100%. Some Medicare doesn't cover at all, some covers. Your insurance says you don't have to pay anything? That's great. You can go to the pharmacy. We can always do a test claim and bill your insurance and see what percentage they can cover. Yeah. Free? So they might, some of the insurance might have changed where it's completely free over 60. That's great. Very good. If you are under 60, so between 50 and 60, you do need a prescription from your doctor. But if you are older than 60, you don't need a prescription. You can just go to the pharmacy and pharmacists can give you a shot. Yep. Without prescription. If you don't mind me asking, what insurance do you have, ma'am? So that's good to know, where they cover 100%. Which insurance do you have which covers it 100%? Good. And I'll try the city insurance again. They do change the benefits every year pretty much. So they're covering more and more preventative cares at no charge now. So this might be the new addition that they are covering at no charge. Some Medicare covers at 100%, she said, where they don't have to pay for it. So the best way is to go to the pharmacy, or you can call me. My phone number will be there, and I can just take your insurance information over the phone and try and see if it's covered at 100%. All right, so now it's a meningococcal disease. And this disease is a serious bacterial illness. It can cause meningitis, which is the infection of the brain and spinal cord covering. So the membrane that covers the brain and spinal cord gets infected, and that's called meningococcal disease. And this disease is very common in infants less than 1 year of age, and at that age it is quite serious infection, and in between the age of 16 to 21 years of age. The main symptoms here is the headache and the stiffness of the neck. So if you have a very bad headache on the back part of your head and your neck is stiff, then that's something that triggers to see, okay, let's check out for the meningococcal. And the skin have a purple patches. So at some parts of your body will develop purple patch, which is also a telltale for a meningococcal disease. There are 2 vaccines for these. One of them is for people younger than 55 years of age, and the other one, the polysaccharide one, is for older than 55 years of age. And both vaccines can prevent all 4 types of meningococcal diseases. It says there are other types of meningococcal disease that these vaccines do not protect against. So these bacteria and viruses are smart. They change their DNAs and they mutate frequently where they don't respond to the existing vaccines or they don't respond to the existing antibiotics. Okay, who should get vaccinated? Children between the age of 9 and 23 months of age, adolescents, and a college freshman living in dorm, laboratory personnel, U.S. military recruits, anyone with a damaged spleen, anyone with an immune disorder, people who might have been exposed to meningitis during an outbreak are eligible to get a shot. So these are all main 4 vaccines that state of Florida is approving pharmacists to administer the shots at the pharmacy level. So we can do that at the pharmacy. But they are thinking about putting all vaccines that an adult needs to be administered by the pharmacist. And there are about other 5 vaccines here: hepatitis A vaccine, hepatitis B, Tdap, which is tetanus, diphtheria, and pertussis, MMR, measles, mumps, and rubella, HPV, human papillomavirus, and you get this as an adult if you don't have it as a child. Let's see, what time is it now?
Do you need boosters of any of these?
You need booster of the tetanus. Tetanus vaccine requires booster every 10 years.
Do any of the other ones?
No. Okay, hepatitis A is a serious liver disease and it can cause jaundice. And that one is mainly found in people's stool or infected person's stool. In fact, contaminated food and drinks can also spread the disease. And you take a shot if you didn't have it as a child after the age of 18. There is 2 shots for hepatitis A that you repeat one and then after 6 months, the second one. Hepatitis B have 3 series, and if you are a healthcare professional or if you work with body fluids or blood, then they recommend you to get those. And there are other recommendations. Let me read those to you too. We have some time here. So it says hepatitis B can be also spread by using an infected person's belongings like toothbrush, razors, monitoring, and other treatment devices for diabetes. Having unprotected sex with an infected person can spread that. Being stuck with a used needle can do that. And adults need this vaccine. Sex partners of people infected with hepatitis B, men who have sex with men, people with inject street drugs, people with more than one sex partner, people under 60 years of age with diabetes. These are the classes of adults who can get this shot. The Tdap vaccine is recommended for a pregnant woman every time she gets pregnant, because the P, which is pertussis vaccine, she can pass on to the infants, and the pertussis complications for an infant less than 1 year of age is very complicated and it's serious. So they recommend a pregnant woman to get that every time she gets pregnant to pass on to the newborn babies. And the tetanus part every 10 years as a booster. MMR have a series of 2 shots again that is recommended if you didn't get it as a child. And HPV have a series of 3 shots which they normally administer when between the age of 11 and 12. But it can be done between the age of 9 to 26. So after that, it's not recommended to take it. Any other questions on any vaccines? Or there you go. So that's me. Yeah, any questions, you can call me. Even though I'm not close by to give you any of those vaccines, I can answer those questions, or Bill, find out if your vaccine is covered and how much you have a responsibility to pay, or any other needs that you have. And we'll be doing flu shots here again at the city in September when the new vaccines becomes available. Flu and pneumonia both. I'll have pneumonia vaccine with me too. We cannot bring shingles vaccine because of the storage. Yes, sir.
If they change the flu vaccine every year, what do they
No. Now, based on the last year breakout of the flu, I mean, what kind of viruses caused the flu that year, they take those viruses and make vaccines to protect against them. So if those viruses stays the same, or as per the scientists' predictions, then we all are protected 100%. But sometimes they don't stay the same, like last year. Some viruses mutated where they changed and didn't respond to the vaccine. So last year, the rate of vaccines protection was a little bit lower than the year before because the virus did change. Yep. All right. Thank you very much for listening in.